Hello, good afternoon. How are you doing today?
I'm doing well. How are you
I'm
doing?
doing good. My name is Michael. I'm going to be your student nurse today. And what is your name
Ashley,
and your date of birth?
12/10/87.
Okay, perfect. Um, I'm just going to check your orders and see what the doctor has ordered for you today. It looks like we're doing a head to toe assessment. Is that okay with you?
Yes, it's fine.
All right, perfect. And I just want to check. I'm going to do some hand hygiene and then give you some privacy. And I'm just going to check your alertness and oriented. Um, and so, do you know who the president is?
Yes, it's Joe Biden.
All right, perfect. And do you know what month it is?
It's February.
All right. And the year?
It's 2023.
All right, perfect. And do you know where you're at?
Yes, I'm at home.
Okay. And do you know why you're here today?
Yes, for a head to toe assessment.
Okay, perfect. You're alert and oriented times 4. And so I'm just doing a brief overview of you. It looks like there's no deformities that I can see. You're properly groomed, properly dressed, and so that looks good. Any concerns with your speech or hearing or your vision?
No.
Okay, perfect. Any headaches? All right. Any earaches or anything with your ears?
No.
Okay. Any sore throat or nosebleeds?
No.
Okay, perfect. I'm just going to go ahead and inspect your scalp and just look for your head is normally around. I'm just checking for any lumps or lesions or anything abnormal. That all looks good. Everything looks symmetric. You make eye contact with me, and nothing is drooping or unsymmetrical or asymmetrical. I'm just going to check your ears. They look symmetrical as well. And I'm going to go ahead and check your pupils. All right, and they look like they're 5 millimeters. And so your pupils are round, are equal and round. And then I'm going to check if they react to light. All right, perfect. They react to light. And then we're going to do an accommodation test. I just need you to pick something behind me and look behind me. And then I'm going to have you look at this pen light, okay? So look behind me and look at this pen light. All right, perfect. And so when you look at a distance, your pupils dilate. And then when you look at close range, they constrict. So your pupils do accommodate on both bilaterally. Okay. All right. And then I'm just going to check the nares of your nose. They look moist and pink. Okay. And then go ahead and we're going to check your patency, which just means if there's any blockages. Yep. Can you breathe out of both sides? Perfect. All right. Go ahead and open your mouth for me. All right. The oral mucosa looks pink. Her gums look tight around her teeth. Good dentition. All right. Perfect. I'm going to check your throat. Your trachea is midline. Let's see. All right, and if you can look towards me, I'm going to check for jugular vein distension, which is part of your cardiac assessment. All right, so the other side. Perfect. So no jugular vein distension. All right, so I'm going to go ahead and do a neurological exam, and what we have is called the Glasgow scale, and it's on a range of 3 to 15. So 3 being you're in a coma, and then 15 there's no concerns there. The first thing we look for is eye response. You're obviously opening your eyes at me right now. Your motor response, you turn your head, so you respond, to commands or demands. And then also your speech response or voice response. And so you're speaking clearly and able to communicate. So So no concerns neurologically. Any tingling of the hands or numbness? Okay, perfect. All right, I'm gonna go ahead and listen to your lungs and your heart.
Okay.
We're gonna start out with your lungs, and every time I touch you with this diaphragm, I just need you to take a deep breath in and out. Go ahead. So I was just in the left or right upper lobe, and now I'm in the left upper lobe. I'm going down to left lower lobe, then right middle lobe. Just take your left arm and reach over to your shoulder. Left lower lobe. All right, and then over. Yep. This is right lower lobe. All right, and just sit up for me. All right, and then your left lower or left upper lobe. Over to your right upper lobe. Down to your right lower lobe. And then your left lower lobe. Okay, you can go ahead and sit back. All right, any trouble breathing?
No.
Okay, perfect. And then any coughing or sputum?
No.
Okay, perfect. So the other thing I want to go over is I just want to teach you on turn, cough, and deep breathe. And what that does is it helps get any mucus up. So you don't have to do it right now, but what you would do is just turn your head, and then take a deep breath in and cough. And what that does is it helps get mucus out of your lungs. And then we also have, there it is. Here's a incentive spirometer. And what this is we would just have you breathe into it, and we would have you reach this line, which is 750 right there. And you just hold it there. You don't go beyond it. You just hold it there. And then you want to do the turn, cough, and deep breathe 10 times an hour while you're awake. And then the incentive spirometer you would do every 2 hours. Okay. And then, all right. So there's that. And then I'm just going to go ahead and listen to your heart. I'm in your second intercostal space, which is your aortic area. And then I'm going over your sternum to your pulmonic area, still in the center, in the second intercostal space. Then down to Earth's point, which is the halfway point of your heart. All right, and if you could just lift up your breast for me. And we're in the fourth intercostal space, which is tricuspid valve. And then midclavicular line, which is your apical pulse. It's also your mitral valve. And this is where you would take a pulse of your apical pulse, and you would count for 60 seconds. All right, and then I would use the bell of my my stethoscope if I was trying to listen for S4 sounds. So you can hear S1, 2, and 3 with the diaphragm, and I heard S1 and S2 with you, so there's no irregularities. And then I would listen for murmurs with the bell. And then I'm just going to go ahead and do a abdominal assessment on you right now. And I'm going to be in your right lower quadrant of your abdomen. And then right upper quadrant. Then left upper quadrant. Left lower quadrant. Okay. Everything sounds good. And then I'm just going to go ahead and lightly palpate The right lower quadrant, right upper quadrant. Any pain or discomfort? And then I'm in the left upper quadrant and left lower quadrant. When's the last time you had a bowel movement?
I guess yesterday.
And you're able to pass gas?
Mhm.
Okay. All right, perfect. And any pain or discomfort in your abdomen area?
No.
Perfect. All right. So I'm going to go ahead and check for edema in both extremities. Looks good there. All right. I'm just checking for capillary refill, which is on 2 seconds. 2 seconds as well bilaterally. I'm going to check radial pulse. It's +2 regular bilaterally. All right, skin color looks normal, no pigmented skin, and the abdomen area, it's not, it looks the same, it's not discolored or disdented. All right, and then I'm just going to check capillary refill on your toes. That's +2. I'm going to check your dorsalis pedis. +2 bilaterally. I'm going to check your posterior tibialis. It's +2 bilaterally. I'm going to check for edema. Okay. No signs of edema bilaterally. All right. Now, if I needed to check further on your pulses, if I was getting irregularities or I couldn't feel them, I would go to your popliteal, which is behind the knee, your femoral, which is in your groin area, your brachial, axillary, and then carotid. All right. All right. Next, I want to do any problems urinating. And what color is your urine?
Yellow.
All right. Any odor? Okay. So that sounds good. If it was darker color, I would be concerned of being dehydrated. And then I'm just going to check skin figure as well. And that is another check for dehydration. And if you could just slide up for me, we're going to start your musculoskeletal assessment. All right. And I'm just going to go ahead and check your range of motion. Any pain or discomfort in your joints or muscles?
No.
Okay. I just need you to flex for me and then down. So that's flexion and extension. And then go ahead and try to flex again. Turn your flex. All right. And then try to go down. Perfect. Let's do it on the side. All right. Try to go ahead and flex and then down to extension. All right. And then flex and extension. All right, perfect. And then same thing for your wrist. Go ahead and lift up, and that's hyperextension, and then down, that's extension, or that's flexion. And then same thing, up, hyperextension, and then down, it's flexion, and then try to go up, and then down, perfect, up, and down, perfect. All right. And then I'm going to go ahead and do range of motion on your knees and go ahead and kick out. All right. That is flexion, or that's extension, and then put back down. That's flexion. And then go ahead and try to kick out again. And then go ahead and kick out. And then try to pull back. All right. Perfect. Same thing for this. Kick out. That's extension. And then go back. That's flexion. Then kick out. All right, and then kick out again, and then try to pull back. All right, perfect. No crepitus or cracking of the knees. All right, and I just need you to stand up. All right, and then I just need you to close your eyes.
Okay.
And I'm gonna put my hands on you. Now I'm gonna take my hands off and just stand there for a couple seconds. All right, no signs of swaying or loss of balance. I need you to go ahead and walk to the wall for me. Walk back. No signs of distorted gait or any signs of limping or any favoring any muscles or. Then go ahead and do a heel to toe walk for me. Okay, and then come back. All right, perfect. No pain or discomfort. All right, you can go ahead and have a seat. All right, and then I think we are good. Any questions or concerns for me?
No.
All right, well, that ends our assessment today, and you have a great day.
Thank you. You too.